perform hand hygiene first of all. My name is Kareli. Hi.
Hi.
Before we start anything, I just want to get your consent for recording and to upload this on YouTube for my class. Okay? So I'm gonna ask, today we're gonna be doing a neurological examination. Gonna ask with a few simple questions like, can you please tell me your name?
Saul Villalobos,
And do you know what day is today?
April 11,
And where you at right now?
at the hospital.
Okay. What brought you in today?
Wellness section.
Okay. So patient is alert, he's oriented to person, place, time, and situation, and his speech is appropriate. So I'm gonna tell you a list of things, and later on you're gonna tell me what those things were, okay? So apple, pencil, scissors, okay? Can you tell me about your first job?
I used to sell cell phones.
Okay. And then what were the three things that I just told you?
Apple, pencil, scissors.
Okay. So memory, patient's memory, remote and recent and remote memory is intact. And that is a normal finding. So now I'm gonna proceed with the cranial nerves. Number one is olfactory. So I'm gonna ask you to close your eyes, cover one nostril for me, please, and you tell me what this smell is.
Cinnamon.
Okay, and then cover the other nostril, please.
Chocolate.
Okay, so cranial nerve 1, which is olfactory, is intact. Now I'm gonna do cranial nerve number 2, which is the optic, and I'm gonna ask you, I'm gonna be standing 6 feet away from the patient, and can you please cover one of your eyes and read the smallest line that you can read?
LTFPH.
Okay, and the other eye, please,
LTFPH.
and then both eyes.
LTFPH.
So patient's visual acuity is 20/20 bilaterally. I'm also gonna test patient's visual fields, and I'm gonna ask you to cover one eye, and then I'm gonna cover the same eye, and let me know when you see my fingers.
Now.
Okay, and then again. The other eye.
Now.
And then again.
Now.
Okay, so visual fields are intact, and now I can do the thermoscope, and I'm gonna look at the patient's eye. And can you please remove your glasses for me? Okay, so I'm gonna do same opposite eye, same eye of the patient, which is his left and my left, and I'm gonna locate, the lights are gonna be dim, and I'm gonna be locating the red reflex, and once I locate the red reflex and the pupil, I'm gonna go in, and I see that the optic disc is yellow orange, the cup margins are sharp, and there is no hemorrhages, no exodus noted, and no AV nicking. So I do the same to the other eye, and I locate the pupil, and then I go in, and I see the red reflex, I see the yellow orange optic disc, no hemorrhages, and the margins are sharp, no AV nicking or exodus, which is a normal finding. Now I'm done with the optic nerve, which is number 2. I'm gonna do cranial nerve 3, which is oculomotor, and I am going to ask you to follow my pen light. Cranial nerve number 3, cranial nerve number 3, and cranial nerve number 3, and I do it again for the opposite eye. Cranial nerve number 3, number 3, and number 3. The other way to test cranial nerve number 3 is by looking at the pupil reaction, so I'm gonna do that right now. Just look straight ahead, and I do direct and the pupil constrict, and then consensual, which means I'm gonna be looking at the same eye, but I'm gonna be lighting the opposite, and consensual is there, so I do the same, consensual, and direct. And pupils are round, equal, reactive to light, which is cranial nerve number 3, oculomotor. And then I can proceed for the cranial nerve number 4, which is trochlear. And cranial nerve number 4 is eye movement as well, and it's gonna be towards down and towards the middle. And I do that to the same eye. Okay, and that is cranial nerve number 4, which is intact. And now I'm doing the extraocular movements. I'm gonna do cranial nerve number 6, which is the abducens. Okay, so look at the side, and then all these segments is noted. That cranial nerve number 6 abducens is intact. Now I can proceed and I can do cranial nerve number 5, which is trigeminal. And what I can do is test. Can you open your jaw for me? Okay. And then I can also test. Can you clench your teeth? Perfect. So the strength is it's equal, it's symmetrical, and patient is able to open jaw without with resistance, so that's normal. And then I can also test the sensory of the cranial nerve number 5. I'm gonna ask you to close your eyes, and you're gonna tell me where you feel soft and when you feel sharp, okay? And where I'm putting it, okay?
Sharp in my forehead, soft in my right cheek, soft in my left cheek, sharp in my jaw, sharp in my jaw.
Okay, thank you for that. So cranial nerve number 5 is intact. Cranial nerve number 6 I already did. Cranial nerve number 7 is facial. So I'm gonna ask you to wrinkle your forehead and then puff your cheeks. Okay, thank you for that. So the movement was symmetrical, which means that there was no facial drooping, which means that cranial nerve number 7 facial is intact. Now we can do cranial nerve number 8, which is the acoustic cranial nerve, and I'm gonna test hearing. So first I'm gonna start with this, and I'm gonna do the Weber test. I'm gonna ask you to close your, let me know if you hear it same in both ears, okay?
Yes.
Okay, and then let me know when you stop hearing it. And this is a Ryan test.
Now.
You still hear it?
Yes.
Okay, and then do the same.
Now.
You still hear it?
Yes.
Okay, so with Ryan test we see the air conduction is longer than bone conduction. And now I can do the whispers test as well, which means that I'm gonna be standing 2 feet away from the patient, and I'm gonna ask you to cover one ear. I'm gonna whisper something, you let me know what it is, okay?
Apple.
And then the other ear, please.
Orange.
So patient's cranial nerve number 8 is intact. So now I can do cranial nerve number 9 and 10, which is glossopharyngeal and vagus nerve, okay? So I'm gonna ask you to open your mouth and say and the uvula rises. And then the other way we can test this is by asking the patient to swallow. Okay? You can swallow? Any problems with that?
No.
No? Another thing we can do is test our gut reflex. And that's it. And we're gonna see the next nerve, which is number 11. And this one is the spinal. The spinal cranial nerve number 11. I'm gonna ask you to shrug your shoulders, okay, and then push my hand with your perfect and the other hand. Okay, so strength is 5 out of 5. Patient did not struggle to put his shoulders up against resistance or his neck. Now I can do the final cranial nerve, which is cranial nerve number 12, which is the glossopharyngeal. No, hypoglossal. Cranial nerve number 12 is hypoglossal, and I'm gonna look at the patient's mouth again. Can you open your mouth and stick your tongue out? Okay, so the tongue is midline, and then can you push with your tongue? Okay, and I'm checking for the tongue movement and strength, which is normal. And those are the cranial nerves. Now I can proceed and I can test patients different types of tests for the cerebellum. Okay, I'm gonna ask you to stand up, and then I'm gonna ask you to walk normal that way. Okay, and when you come back, put one foot on front of the other, which is standard walk, and that is intact. And then when you go back, I'm gonna ask you to walk with your heels. Okay, and then when you come back, do on your toes. Okay, so the gait is steady, the patient's posture is normal, he wasn't unbalanced, and that is a normal finding. I'm gonna do the Romberg test. I'm gonna ask you to close your eyes, and in this test we make sure that we are close to the patient in case the patient loses his balance, and we wait for around 20 to 30 seconds to test the Romberg test, which means that patient's balance is intact. And then the other thing, I'm gonna check for pronator drift. Put your hands up. Okay, I'm gonna let them go. And then both arms stay up, which means that there's no pronator drift, and that is a normal finding. Thank you. Now, I'm gonna ask you to sit down again, please. And we're gonna do coordination. And this is what we ask you to do, is I'm gonna ask you to do your hands like this, as fast as you can. Fast. Okay, so patient is able to coordinate, and it's rapid movements, how alternated. And then the other thing we can do is, I'm gonna test the patient's senses. I'm gonna ask you to put your hands up and separate your fingers, close your eyes, and let me know if I'm pushing your finger down or up, okay?
Down, up, down, down.
Okay, so that means that the patient's senses up and down positioning is intact. Okay, so now I am going to continue to test the patient's senses and sensory. I'm gonna ask you to close your eyes, and you're gonna let me know if you feel 1 or 2 points. Okay, put your hands like this. Okay.
1 point, 2 points, 1 point, 2 points, 2 points, 1 point, 2 points, 1 point.
Okay, I'm gonna do upper and lower extremities.
1 point, 2 points, 2 points, 1 point, 2 points.
Okay, so this means that with 2-point discrimination, the patient's sensory is intact. Another thing that we can do is check if you feel for pain sensation, and I'm gonna do the same, but this is soft, okay, and this is sharp, okay? So I'm gonna do it both in your arms and on your legs. Close your eyes, please.
Sharp, soft, 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 sharp, soft, sharp, soft, 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 sharp, sharp.
Okay, so patient's pain senses and it's able to differentiate between a sharp and the soft, and that is a normal finding. The other thing that we can do is check either this, we can do this, or we can do and check your patient's reflexes before he stands up. So can you stand up? Okay, so I'm gonna test the patient's tricep reflex right here, and then the biceps right here, and then the brachioradialis right here, and I can compare it to, I have to compare with the other, and this is the tricep, and this is bicep, and then the brachioradialis, and normal findings will be 2+ deep tendon reflexes and symmetrical. Now I can also keep up in the upper extremities, and we can do test the patient's for muscle weakness or how the patient's muscle strength is. So I already tested the shoulders, so we can do the biceps, and don't let me pull you towards me, pull towards you, okay, and then the other side, pull towards you, okay, and then don't let me push you, okay, and then same side, some testing the biceps, the triceps, and we can also test the wrist, and then don't let me push it, okay, and then don't let me put it up, perfect, and then test it to the other, don't let me push it, and then don't let it put it down, perfect, and then I think I can do your deltoids, try to put your, don't let me push it, okay, so the patient's muscle strength is intact in the upper extremities, including biceps, triceps, shoulders, and wrist. I can also test a patient's hand grip, grab it as long as you can, and there is equal bilaterally, and then I can test the patient's fingers as well, separate them, and don't let them put them together, okay? So I compare, and it's symmetrical, and the strength is 5 out of 5. So I think I'm done with the upper extremities. And now I can do, one thing we can do to test the patient's sensation is check for a stereognosis. Can you close your eyes? And I'm gonna put an object in your hand. Let me know what that object is.
A remote control.
Okay. And then, how about this object?
Kiss.
Okay, so patient is able to identify objects, and that is a normal finding for stereognosis. And now I can proceed and do the lower extremities. We already tested sensation with the 2-point discrimination and the pain sensation. I can check patellar reflex and compare it to the other side. And I can also check the Achilles reflex, which is at the ankle, and compare it to the other side, which should be 2+ symmetrical reflexes bilaterally. And now that we're gonna continue checking the lower extremities, but it's gonna be with you laying down. Okay. Okay, Okay, so now we can proceed and we can check the patient's lower extremities, which is gonna be checking different muscles, the strength of them. And I'm gonna start with the hip. Lift your leg up like that. No, straight, like that. And don't let me push it down. Perfect. And then the other leg. Perfect. And now bring your leg out and don't let me push it in. Perfect. And then the same with the other. Perfect. And now don't let me push it out, okay? Perfect. And then the other. Perfect. So I'm comparing the patient's strength, and it's 5/5 with all the different movements of the hip. I can also check the patient's knee, which is don't let me pull it up and don't let me push it. Okay, and then I compare it and put it down and don't let me push it. Okay. So I did the hip, I did the knees, which is 5/5 and is symmetrical. And we can also check the patient's ankle strength. Put your feet up. And don't let me push it. And then point. Perfect. So the patient's strength to ankles is also 5/5. And the last thing that I'm gonna do is the Babinski. Oh, sorry. Okay, so that is a normal finding, which means that the feet retract with the Babinski. And that is it. That's the end of the neurological exam. Thank you so much for your time.